Good morning, everyone. So my name is Camille Bellet. I currently work as a researcher at the Institute of Infection and Global Health at the University of Liverpool. I am a veterinarian, epidemiologist from background, specialized in public health, and I'm currently specializing in the sustainability of agri-food systems. So first, I would like to thank the projects SAPHIR and Feed a Dream for the invitation to talk and to be here with you today. What I'm going to talk actually is part of a research that I'm currently developing at the university with some of my colleagues, in particular Professor Jonathan Rushton and Dr. Leanne Thomas. This is work in progress, but hopefully will give you some kind of ideas of the questions we are interested in. And of course, I know time is limited, so my idea is really to stimulate thoughts and to see where we go with discussions after the talk. So, as far as we know, to make sound health decisions and to plan for effective intervention strategies, decision makers, but also a wide range of stakeholders need the best, I would say, and most accurate and contextually relevant evidence, which basically relied on data, information of a wide type of sources and places. And in this presentation, what I wanted to talk about, it's taking the example of vaccines, strategies against livestock diseases. I wanted to think with you about what this means, best contextual relevant evidence to make sound decisions. So first, to start with, why are we interested in vaccine? To plan for strategies and better strategies against livestock diseases. Well, livestock vaccine can help protecting against acute diseases. We all know the example of rinderpest in the past. FMD is another one. But of course, they do not only target acute diseases, they also can help to fight more chronic diseases, such as coccidiosis, which also impact the health, the welfare, and the productivity of livestock systems. Importantly, the benefits of vaccines are not limited to the recipients of vaccines, but also to the unvaccinated animals, and more broadly, in the case of zoonosis, to other animals, which I would say, the human populations. And finally, vaccines can help to reduce, in some cases, the use of drugs, which ultimately can be also a help to reduce the selection pressure for drug resistance and might improve the efficacy of drugs in humans. So, as we can see, there are a lot of drivers of vaccine development. There are many and they are varied. Now, for any vaccine investment to be made, of course, there are some decisions to be made. When I say for any vaccine investment to be made, I mean for any vaccine to be first selected, then developed, and then implemented in the field. Decisions must be made because, of course, budgets are limited. And this means that decisions must be made in terms of the disease targeted by the vaccines, the priorities of this disease from a societal perspective, also the feasibility of the technology development, and the feasibility of the intervention itself. And this would necessarily be involving a lot of stakeholders and many parties with different views. Here I wanted to ask how decisions are made today in the livestock sector. Well, the willingness to invest, as you know, in any kind of technology depends on the different value attribution we have. And in this case, in livestock, we could say that it mainly be divided in two. First, money, trade, with the example of FND vaccines, and also public health with the development of vaccines against zoonoses such as avian influenza. Now, before coming back to this, I wondered how do we make decisions? So what are the tools we apply as scientists to try to value, to prioritize vaccines in the field? In a research that we are, you don't see it at all, but I will try to explain it well. In a research that we are currently doing in the SAPHIR project, we were interested in trying to understand the way animal health scientists frame questions and their representation of impact and impact assessment of vaccine technologies. And we did that by focusing on the diseases, six pathogens we were interested in Europe. And we collected 280 papers that actually were corresponding to our keywords of search. I don't have time to go further into detail, but I would be happy to explain it more. And basically, on the 280 papers we collected, only 8% of the empirical research were making some kind of impact assessment. And in this impact assessment on these 8%, the way economics were used was generally inappropriate, and which made the assessments of the disease impact quite flawed. In another study, we wanted to, because I talked about attribution of value of the species we are working in, and in another study, we were interested in comparing what's happening in the human field for vaccine development. And actually, when you do try to see how many cost-effectiveness studies are done in the human field, you can see the tremendous differences, 160 in the animal field, as opposed to more than 1,000. And generally, the 160 focus on very specific diseases, and most particularly zoonoses. So the way animal health scientists use and understand economics is part of a struggle currently experienced by the animal health research in the optimization of disease intervention. In the economic approach, there is a real wish to understand the context by applying different approaches and different tools to try to understand the way resources are allocated, to identify where are the weak resource and why it is weak, and try to reallocate the resources. While in the animal health approach, what we also have seen in the 8% paper we talked about in the SAPHIR project, generally the economic is made after the disease program is decided, and there is kind of justification of what has been done by using some economics, which, as I said, are generally inappropriately used. So in one way, we are trying to add value through the searching for optimality of our resource, and the other way, we try to add value through advocacy. And the lack of money and resources associated with the frequent lack of perceived value of livestock disease and their health, as I said, only focusing on zoonosis or epidemics, with very few exceptions, so makes that we come to this kind of situation where we have a disease prioritization and the development of vaccine based a bit on industry lobby groups private interests or kind of scientific personal preferences. And when we have time, we do some economic analysis, but generally the data you are basing your analysis on is quite very weak. But the critical point here is this drives to the list of diseases that would be notifiable. This leads to also the disease programs, that are also made for endemic diseases. And also the poor data and the poor analysis can link to the poor investment made can also lead to crisis and the delivery of livestock vaccines that actually are not safe. Here is the example of the striking crisis provoked by the use of a Prexure vaccine in Europe, which led to a bleeding calf syndrome in Europe and in other countries. So I hope it's quite clear that we are in a situation where we plan decision, but what is used to support our decision is quite wobbly. Now, a better understanding of the socio-economic benefits of livestock vaccines, as I said, start from the understanding of the burden of the disease. What triggers the disease in terms of economy, yeah, but also social impact of the disease, environmental impact of the disease. And this needs to be considered in specific contexts, because working in northern countries would not be the same as working in southern countries. Working in Cambodia would not be the same as working in Netherlands or in France or in the UK. And this requires the interpretation of different data, different information, different approaches, both quantitative and qualitative, and strong interdisciplinary, and transdisciplinary approaches, where everyone would be participating to the process of the assessment of the disease. Then, understanding the burden of the disease, a decision can be made on the priority of this disease and on the decision to develop the vaccine. And then we can start. And then, of course, it's important to understand the effectiveness, the safety, the cost effectiveness of the vaccines, which also in turn would influence the acceptability of the vaccination to the end user. And as we know, this process is demanding in time, in resources, but is critical. And we do not believe that we are yet now in the veterinary field. It is much more advanced in the human field, but all the discussion you are making today, our encounter, prove that it might be the right time to change a bit the trend. And also I would like to mention that coming on the observation we have made with the SAPHIR project, we are currently working on a program, the global burden of animal disease, and the first planning had been held this year in the OIE, and this initiative aims to develop a system that would regularly collect, validates, analyze, and disseminates information on the economic and social impacts of animal disease in different contexts, taking different levels, which means at the global, national, and sectoral level. And vaccine will be included in this program. And this program draws on the principle that already had been made in the human side with the global burden of disease, and will incorporate principles of economics, social sciences and all the other hard sciences, which you are mainly working on. The idea being to really look at net losses of diseases and stop limiting the impact of diseases to actually zoonosis again, and diseases that impact the global market of powerful countries. And this will support the process of differentiating impact by species and production systems, and will help to reallocate reallocate resources within different countries for a specific disease, but also between diseases. And overall, this project really is a strong, will present a strong economic and social cases for animal health investments, which we all know we need as animal health scientists at the moment. And so with this, I leave you, and I'm happy to talk a bit more about it, and hope that you will come and join. Thank you.
Thank you, Camille, for sharing these thoughts with you. And I think that independent of your discipline, you recognize yourself somewhat in that scheme that you showed of the model, how it works, and that we have to change probably. So thank you very much. Questions for Camille?
Don't you think that the difference you have shown between human health sector and animal health could be due to the existence of public policies for human health and social security and all the system so that the public money contribute to determine the cost of the vaccine, and this is completely different in the animal sector?
I think you can take in different ways. So if I understand well, the fact we have all these different organizations and institutions which obviously allow to collect more information in the human field is related to the fact that we think it matters. It obviously matters to protect our human population. So it's always coming back to the investment we make, to the priority we decide to put. And so in a sense, yes, it's related to it. But then we need to rethink and to see how much it impacts, how much animal health impacts, how much actually animal health impact not only from a perspective of disease dissemination to the human population, disturbance of the environment and the livestock population, but also in terms of change of the environment, in terms of different strategy, as I said, with the decision we make might affect our society in terms of animal health. So yes is my answer, and yes, we need to do something about it, but I think that the only way we can change a bit the way things are organized is trying to rethink our way of prioritizing things. Animals are living with us, and they are impacting us in many ways that we actually overlook at the moment, in terms of the place they are living in, which is a shared environment with us, in terms of the products they are giving us on our plates. There are many things that we don't think, and projects like the one we presented here, I know less the feeder gene, sorry, but the SAPHIR project focused on chronic diseases that most of the time are really overlooked because we don't know they are really subclinical, we don't see them. we think they are not important, but they might be much more important than we think, and from different points of view, for the health point of view, but also the development point of view.
Yes, Claire, brief, and then we start the panel discussion.
Excuse me, how do you connect with the One Health initiative? Because sometimes it's very difficult for the human side to discuss with the vet side, even if there is a main trend to try to connect. So you see in your global burden of animal diseases program, how do you deal with this you see issue of better connecting animal health and human health and the environment in the frame of the One Health initiative?
So the people from the human side have been involved in the building of the concept and the program. People from the Global Burden of Disease from Washington came, and they are participating in the discussion. So there is a real wish to involve, so it's scientists, it's industries, it's, I would say, human and animal health scientists, and also it would be consumers, it would be other publics that needs to be here to develop actually the program, and not to be excluded and then to be presented the program and having to apply it with actually a voice.
Okay, thank you, Camille. Please, yeah, you can. Thank you.